before you. So I'm going to actually turn over the microphone to Carol Nagle. And as Julie mentioned, she's the CEO of Family Services Association. And the Department of Public Health was delighted to have Family Services participate in our first phase back in 2008. And I'm thrilled to have Carol here because not only has Carol taken a leadership stance, which is very important at the top to set that stage, but she has a fabulous team underneath her, and she has a wonderful platform of employees who have really begun to kind of take this to the next level. And I have to share with you, they were awarded by Partners for Prevention. They were showcased in their Leading by Example. Healthiest Small Employers, this is a national document, which I'll make sure that's available for anyone. And Family Services was one of the small businesses that was showcased in that national publication with Carol kind of leading.
Okay, great. Good end to the morning to you. Thank you so much for staying. When I was told that I would be coming on around 11:30, quarter to 12, and it was ending at 12, I'm thinking, I hope everybody stays, or some people stay. So thank you very much. It's been a wonderful morning, as I've heard. And I am very excited and proud to be here. And I'm proud to announce to you that the Boston Business Journal has just announced that Family Service Association is a finalist in the Healthiest Employer Award this year. And I say that because I'm scratching my head saying, how did this happen? This isn't how it felt back in 2007 when I was sitting in a room full of people drawing out a strategic plan. And the strategic plan looked like this. This program's going to grow. This program's going to replicate itself in a different area. We're going to add to this. It was all very program-oriented for a social service agency. Made sense to me. But as we were sitting there, one of my senior members looked at me and said, do you have an initiative, something that's on your mind that you've always wanted to do but didn't quite fit into the plan? And I said, yes, I really have. I want to do something with wellness in the workplace. I want to do something for our folks, for the work folks. Because when you're in an industry that is constantly giving to others, sometimes you really put yourself last. You're bottom of that list. And as I was looking at my employees, they kind of looked tired to me. Sick time actually was going up, but they were coming in, and people were saying, no wonder I'm leaving now because I'm coughing. The person on the side of me is sneezing. And we just didn't feel what I thought was a healthy work environment. And as the CEO and the senior managers were sitting there, I thought that's our responsibility. We've got to create a work environment that's healthy for everybody in a number of ways. And everybody was like, yeah, let's do it, let's write it in the plan. And we wrote it in the plan, and then I went back to my office and went, where do you start? Where do you start with such a huge initiative? We knew we had the heart for it, but we weren't quite sure how to go about it. So we started in a very, very small way. Because if you Google, there's a national month for everything in this world, right? So that's just where we started. I can remember National Breast Awareness Month. Oh, that was an easy one. We got pink ribbons, we passed them out at meeting, and we had a breast cancer survivor, and she was outstanding. People promised me they'd go for their mammogram, and we were off and running. And then it was National Heart. Go red! We're rolling red! Red is all you could see at Family Service, and it was terrific, and everybody felt good about it. But as I was walking back to my office, I was getting ready to enter the building, and I was hit by a wall of smoke. And I thought, this is not enough. Raising the awareness of your employees is simply not enough. We have to be involved in the changing of their lifestyle. We wanted it to be more healthy. So we could not just talk to people about that. We have to help them make those changes. And where was the first place we were going to start? But smoking. We had quite a few smokers, not the majority, but we had smokers. We allowed for smoking breaks in the morning and in the afternoon. We allowed smoking not in the building, but around the building, in the parking lots, and that's what you'd see when you drive by. Somebody was out there taking their quick smoke. And we knew that all of that really needed to change. But it wasn't that we were going to change it overnight. I know you've heard that time and time again. It's a process. It's absolutely a process. But at that point, we knew we needed a partner. We needed someone to help us build and provide us with the tools to create that healthy workplace. And that's when we found DPS in the state with all of these worksite wellness programs and information about how to go about becoming a tobacco-free workplace and campus. And that's what we are today. A year ago, we established that, but not without starting with smoke cessation programs. We're a licensed behavioral health center. So we got one of our clinicians to come in who had some curriculum for a 10-week program. We bought the gum, we bought the patches. We did as much as we could to bring about our workforce. And we had many, many folks who did kick the habit. Not all of them stayed with it. Some folks have repeated that program over and over again. But I tried to go to those meetings and listen to them. What's preventing you from stop smoking? Some of them said to me, well, I go home at night, my husband lights up, and I smell that smoke. I'd bring him in. I'd like to meet him. Bring your husband in. And she did. And before long, FSA's family just kept growing and growing. And it's a good thing, because if I could help, actually, her husband kicked the habit and she didn't. So it might be but, you know, these are the types of things that we got information on. How do you go about doing this? How do we help folks? Because we were serious about it. We eliminated that break for smoking. Nobody has breaks any longer. We eliminated the ability to go out. If you've ever been to family service, you know we have 3 buildings. They form a triangle. So by not allowing it on the campus at all, you kind of, the side streets, it's a huge block now and it's smoke-free. And although people would go out into their car and try to leave at lunchtime, that got old fast. So if they didn't quit, they certainly slowed down on what they were doing for smoking. So it was really successful. And we got really pumped on this. So we went over to the exercise program and we said, oh, we're going to have Zumba, we're going to have yoga, we're going to introduce all these things for you. And again, we needed partners. So we partnered up with our CD Rec Center, because the first yoga session that we put out there, we had in our conference room. And it has carpeting. So I had more people walking out of there with sprained ankles than anything else. And it's quite a healthy program, right? So we knew that we needed a gym, right? It's those trials and tribulations that you learn. And so people said to me, but it's not on site, it's not convenient. I said, it's a block down the street. This is a wellness program. What are you talking about? We can do this. And we talked a little bit about biking. We've seen a lot of biking here. And we said, you know, does anybody have a bike? So should we actually go out and purchase some bikes? And at lunchtime you can go out. And we're like, that's a great idea, Carol. And I'd like to exercise in the morning and I'd like to bike at lunchtime. I get all sweaty. I'm going to really, you know, I'm not going to be presentable. I'm not going to be professional. I know you like me to be professional. So I said, hey, how about if I take one of these 14 restrooms that we have and we change it to a locker room? They looked at me. You would do that for us? Yeah, I'd do that for you. With the grant money, we were able to make some environmental changes. We brought in a contractor, we brought in a plumber, and I stood there with those big sad eyes. I want to do this for my peeps. Can you help me try to recreate, put a shower in here, have some lockers so they can lock their sneakers up and not worry that they're stinking up their office? What can we do to change this around? We now have a locker room. It happened, and it happened because of the really partnerships that we formed and the willingness of employees to try to come along on this wellness. And then we thought, hey, I'm running out of ideas. Here's a novel thought. How about asking them what they'd like? So we started surveying people. And with that came the reports that we had to do. We now needed to start tracking outcomes. Are we making a difference? And with all that infrastructure that we got through the grant, the reports that were due, it formalized the process for us. So what started with a lot of heart really grew to something that was much more than that. And we started getting input from folks. Hey, we're a behavioral health center. We don't do anything on stress reduction or stress management. So what would you like? I'd like a book club. You got it. You got a book club. That was easy enough. At lunchtime, they have a little potluck. They bring their book in. They talk. It's open up to everybody in the agency. And one month I did something. I asked them, what are you going to read next month? And they told me, I bought that book. And I sent it over with a lot of fanfare. And they opened that up and they saw it was the next one. You would think I gave them $1 million bonus. The thank you notes that I got just to show that I was trying to make that process a little bit easier for them was incredible. We do stress reduction with yarn works. They like to crochet or knit. Some people who've never done that and wanted to learn come in and they feed off each other. We probably have 25 people at lunchtime once a week doing that. And they wanted to take something on. So they contacted Special Olympics and they knitted scarves for the Winter Games for the special athletes. And they felt terrific about that as well. I mean, there's just tons of things that you can do if you ask people what they want, what their interests are, and how can we help you get from here to there. I believe we have a much healthier workforce today than we've ever had, and we've just scratched the surface. So I want to thank our meaningful partners. I have like tons of ideas. We've been in podiatrists and had an agony of defeat, which was actually a runway where our employees walked down and the podiatrist stayed at the end, and when they got to the end, they had to face his critique of what their footwear was like and what it was doing to their feet. So you can have fun with these things. And believe me, I'm here to say to you, get started in some small way. You never know. You could be a finalist in the Healthiest Employee Award. And I'm here to share any of our ideas with you. If you like any of what I've said, if you'd like to hear more of it, we have tons and tons of literature on it. But just, get started and keep them in the forefront. Thank you very much.